I was taking a shower and felt a lump, a very big one. I had an appointment with my doctor. He said, I think this might be cancer. I had a kind of a semi-rare form of cancer. It's triple negative cancer. Because of the kind of cancer I had, it's more aggressive, it's more likely to recur, and it's more likely to recur quickly. The recommendation was a double mastectomy. I had the surgery, and then I had 7 weeks of radiation.
That's just one patient story of many, many who Dr. Debra Camal has seen instances very similar to that. You are the medical director of the breast program at Meridian Cancer Care. I should make mention that this is part of our Meridian Health Taking Care of New Jersey programming. First, I want to welcome you to the show.
Thank you so much.
You do see cases like that every day, don't you?
I do. I would say every day. And, you know, women come in at different stages of diagnosis. Some just feel a lump. Others have had the mammogram. But they all kind of share something, this basic fear of what's ahead and not really understanding the steps. So I'm there to, I hopefully guide them through it.
You are there to guide them through, but you say it takes a team. Particularly with breast disease, it takes a team. This kind of disease lends itself to a team effort. Why is that?
Absolutely right there. You know what, once a breast cancer diagnosis is a complicated type thing. It starts with often a woman feeling a lump, and early on in the process, breast imaging is really important. So you have a radiologist who is diagnosing the cancer and often performing a needle biopsy. Then often a woman is sent to a surgeon, but as I tell all patients, surgery is not the only thing you generally need for breast cancer. It's often surgery to remove the cancer, sometimes chemotherapy or some other type of systemic treatment to prevent recurrence, and in some cases radiation as well. So
hormone therapy, how much are you involved in hormone therapy with your patients?
Well, I'm often not the one that prescribes it, but I'm generally the one to introduce the concept, because about 70 to 80% of breast cancers are estrogen sensitive, and those cancers will respond well to a pill to block estrogen. And it's an important part of treatment. Often treatment goes on for quite a few years after surgery. So, you know, I'm part of, I hear about the side effects and the problems women have sometimes, so I'm part of that process as well.
You have been a breast surgeon for 16 years.
Yes.
You have seen quite a few changes in treatment and even diagnosis of breast cancer over the year. What are some of the latest technologies that we're seeing?
Oh, I've seen some really tremendous changes over the years, whereas when I first started practicing, needle biopsies were a brand new development. Now they're absolutely standard of care to diagnose breast cancer. Also, the breast imaging techniques, mammograms have gotten much more advanced. We can see cancers that are far smaller than we could see many years ago. And other advanced technologies like breast MRI, tomosynthesis, certain types of ultrasound, these are all being used to help women, you know, figure out where the cancer is so that we can figure out what types of treatment would work best.
It's interesting. You said to our producers that of all the things that you do, you still love talking to the patients and the families. And that, I have to tell you, surprises me, because I would think that would be the hardest part.
You know, that's funny, and because you bring it up as a point, surgeons are not always considered to be the most communicative, or many surgeons dislike office hours and only really like to do the surgery. And with breast surgery, you know, the process of meeting the patient and the family, establishing really what I call a mutual trust, because here's a person coming in knowing essentially nothing about breast cancer, and in an hour and a half, I have to get them to understand me and how I think. I need to understand them and how they think, and in what setting they're coming from. You know, is this a single mother with small children, or a woman who's caring for her elderly father? And this all has to make sense within her life. And I really enjoy the explanation, the teaching part, and the letting that patient feel that I'm their advocate, not just in the beginning, but all the way, really for years and years beyond the diagnosis.
Let's talk about the breast program at Meridian Cancer Care, excuse me. What is the goal there?
We have many goals actually at Meridian Cancer Care. I mean, Meridian being a 5-hospital system, one of the things we really like to do is make sure that the quality of care and services is at the very highest level throughout the system, and that requires constant procedure review and making sure all the standards are where they should be. In addition, one thing we feel very passionately about throughout the system is the concept of a multidisciplinary conference.
What does that mean, multidisciplinary conference?
What that means is at each hospital, at some hospitals weekly, at other hospitals bi-weekly or monthly, I get together with probably about 20 or 25 other doctors and healthcare professionals who treat breast cancer to discuss patient care anonymously. So for example, if you're diagnosed with breast cancer, I've seen you in the office, I can present you at conference, no names are used, but we review films, pathology slides, and this is often done before treatment starts so that there can be a committee-based recommendation as to the next step in care.
So it's really a comprehensive approach to each individual's specific needs.
Absolutely, and care often changes as a result of this conference. Like I might think that, someone with an aggressive cancer should have surgery as a first step, but then when I discuss the case with a medical oncologist, they might say, you know what, I really feel that chemotherapy should be done prior to surgery. And then I'll call the patient and say, this is what happened as a result of conference. I see why that should be done that way, and I change the recommendation. It really is for the good of the patient overall.
And I wish we had more time, but in the time that we have left, nurse navigators are a really important part of this process. Why is that, and what do they do for the patient?
I love the concept of nurse navigators because it's a reflection of the fact that women don't just have surgery for breast cancer. They have to be walked through a process from diagnosis to treatment to aftercare and survivorship. A nurse navigator is kind of like a really informed best friend because, she will know everything from which doctors to see to what your imaging test results mean to where to get a wig if you need one. And they're a wonderful source of information for patients and families and for whatever hospital resources are available. So they're an advocate for the patient. They're also an advocate for the physicians because when we don't have time to address every small issue, the nurse navigators come in and they fill in the blanks. So it's a wonderful addition to the program.
Dr. Debra Camal, Medical Director at the Breast Program at Meridian Cancer Care, you're making a difference in the lives of a lot of women. Thank you so much for your work.
And thank you.